Hey everyone, my name is Dr. John Wigg, Chief Medical Officer at Express Scripts, and I'm here today on behalf of the Laborers Health and Safety Fund of North America with an important message about the COVID-19 vaccines. I'm filming this myself, by the way, so hopefully this goes without any hiccups. Firstly, the Laborers want every LIUNA member to know where things stand, not only with the vaccine rollout, but why it's so important for you to get vaccinated. And there is a lot of information out there that it's sometimes very hard to tease out what's factual and what's not, and who to really trust. Hopefully I can give you some information that's practical, that can help you with making that decision and really re-emphasize why this is so important. I also want to preface that a lot of this information is changing minute to minute, hour to hour. So a lot of things we talk about may change, but this is sort of what we know right now. So let's first level set. This is the biggest vaccine campaign in history. Right now we're at about 57 million doses, at around 1.6 million doses given every day in the United States. At that rate, it's going to take about 9 months to vaccinate 75% of the US population. From a global perspective, if you look at the rate of vaccinations, to get to 75% of people being vaccinated worldwide, it's going to take about 4 to 5 years. Why I'm focusing on 75% is that's thought to be the degree of immunity you need to reach in order for life to get back to some degree of normalcy. And why we care about the world is we need to combat the virus wherever it is. We can't just look at it from a US perspective. And it kind of tells you we have a lot of work to do, and this virus is going to be around for several years. Most experts feel like this is going to be a lot like how we approach the common flu. We'll probably need vaccinations every year, but it's important to keep that perspective in mind. Let's move on to vaccines and what's out there. So I think most of us know the two vaccines that are currently being used in the US, Moderna and Pfizer. These are very effective vaccines. They are 95% effective in preventing disease. They are 100% effective in preventing someone from being hospitalized or dying. That's very, very important. There are 3 other vaccines in the pipeline for approval in the United States. One is from a company, AstraZeneca, the other from another company, Novavax, and the third from Johnson & Johnson. I'm going to focus just on Johnson & Johnson because that was just submitted to the FDA a few weeks ago, and we expect approval pretty soon. This is a one-shot vaccine. It does not have to be cold stored like a lot of the other vaccines that require freezing temperatures. And so it can be stored in a common refrigerator. And it is also very effective. It's 50 to 70% effective in preventing disease. It's 85% effective in preventing someone from being hospitalized, and it's 100% effective from preventing someone from dying. And the fact that it can be stored in a refrigerator and it's one shot, you're going to see this being much more logistically friendly to going to a CVS or a Walgreens to get your shot. So it's important to keep that in mind. Let's move on to safety. I think the single biggest reason people don't want to get vaccinated is because of fear of side effects and whether the vaccines are safe. So take a step back. The number of people enrolled in these studies to look at the efficacy and safety of these vaccines was quite significant. Tens of thousands of patients, far more than even in the last couple of years combined. Okay, so we're very comfortable with the rigorous nature of these studies. The second aspect is side effects. Just in vaccines in general, the vast majority of side effects occur within the first 48 hours. It's very, very uncommon to have severe side effects from vaccines. It's very uncommon to have side effects that are further out. So what we're seeing for the information that we have now is that these are very safe vaccines. The side effects are minimal to moderate. They typically represent sort of flu-like symptoms that are fairly self-limiting and go away within 24 to 36 hours. And to date, we've been pretty pleased with that. We have not seen any signals for severe side effects, but we need to continue to sort of monitor that. So that's very, very important. I think the other part I wanted to just discuss beyond that is just the variants that you're probably hearing about in the news. There are newer strains, newer variants of the original COVID strain that have been identified. One variant was found in the United Kingdom called the UK variant, and the other in South Africa, referred to as the South African variant. So this has nothing to do with the country or the peoples. This is just sort of where they detected the variant to begin with. A variant is really a mutation or a set of mutations within that original strain. And what we're seeing with these variants is they tend to be far more transmissible. So it's much easier to get infected. And in fact, the UK variant is likely going to be the predominant variant that's going to be seen in the United States in the next couple of months. We also know, and there's some signals, that these may be more harmful to us than the original strain. So more infectious, a little more harmful, and we need to continue to follow this. And when you look at the vaccines and their efficacy with these new strains, we're still learning, but they still seem to be efficacious against these strains, some more than others. But when you start to put all of this together, that we clearly need to get to a certain degree of immunity for life to get back to normal. We have vaccines that are very efficacious, particularly in preventing hospitalizations and death. They have a very good side effect profile, and then you have these new variants coming. You can see that this is sort of the decision that we have to think about making, and why it's so important to get vaccinated. One other thing to add to that is this syndrome called COVID long, and what that means is that the COVID virus is not like the common flu virus or a cold. There are things about this virus that we just don't know. So we know from studies that 80% of people that had COVID-19 and were admitted to the hospital still have significant side effects 9 to 12 months after they were discharged from the hospital. Even patients who were asymptomatic or had mild infection, they continue to have symptoms. About 20 to 30% of them continue to have symptoms even 6 to 9 months later: fatigue, slow thought, depression. So when you put all this together, and taking a medicine, making a choice to get vaccinated is a risk-benefit decision. In medicine, I know this from treating patients, it's never perfect. You never want to take a medication, but in this instance, when you start to put all of this together, it makes a lot of sense to vaccinate or to be vaccinated. So very, very important. The last thing to just discuss is masks. There's a lot of questions about, do I need to wear a mask after being vaccinated? What's the data on that? So we do have some CDC guidance that, wearing a more snug mask or double or triple masking may be more effective. But, just with regards to vaccinations, you still need to wear a mask even after you're vaccinated. Likely, the main reason for this is we still don't know whether you can transmit virus or not after being vaccinated. And, until we get levels down to a little bit of a better state within the country, it's probably more appropriate to wear masks. I think this is likely going to change in the next 6 to 9 months. But for now, that's what the guidance is to date. So those were the main things I wanted to talk about today. On behalf of the laborers, please be safe, be well, please get vaccinated, and consider getting vaccinated when it's available to you. Don't worry about what vaccine you're getting. Get the vaccine that is available. We, of course, are here for you anytime. If I can get on a call and answer questions, I'm happy to do so. So with that, have a really good night.